Welcome. Today we're diving into a serious and complex disease, esophageal cancer. This video aims to provide a comprehensive overview of this condition, covering its causes, symptoms, diagnosis, treatment, and more. While this video provides educational content, it's not a substitute for professional medical advice. Always consult with your doctor for any health concerns. So, what causes esophageal cancer? The exact cause isn't always clear, but several factors significantly increase your risk. The two main risk factors are chronic, persistent heartburn, also known as GERD or gastroesophageal reflux disease, and Barrett's esophagus, a condition where the lining of the esophagus is damaged by acid reflux. Other risk factors include smoking, heavy alcohol consumption, obesity, a diet low in fruits and vegetables, and human papillomavirus or HPV infection. Certain genetic conditions can also play a role, although this is less common. Now let's explore the pathophysiology of esophageal cancer. This is how the disease develops and progresses at a cellular level. In essence, it begins with abnormal cells growing uncontrollably in the lining of the esophagus. This uncontrolled growth can then invade surrounding tissues and organs. In Barrett's esophagus, the normal cells of the esophageal lining are replaced by cells similar to those in the intestine. These altered cells are more likely to become cancerous over time. The cancer can spread through the esophageal wall, reaching lymph nodes and eventually distant organs like the liver, lungs, and bones. The specific pathway of this spread depends on the type and location of the cancer within the esophagus. Who is affected by esophageal cancer? Understanding the epidemiology is crucial. This cancer is relatively uncommon, accounting for about 1% of all cancers diagnosed in the United States. However, its incidence varies greatly depending on geographic location and ethnicity. Esophageal cancer is more common in men than women, and the risk increases with age, with most cases diagnosed in people between the ages of 55 and 85. Certain ethnic groups, such as African Americans, have a higher risk of developing the squamous cell carcinoma type of esophageal cancer. What are the signs and symptoms to watch out for? Unfortunately, esophageal cancer often doesn't noticeable symptoms in its early stages. As the cancer progresses, common symptoms include difficulty swallowing, known as dysphagia, which may start with solid foods and eventually progress to liquids. Other symptoms include unexplained weight loss, chest pain or pressure, heartburn that worsens, a hoarse voice, chronic cough, and vomiting blood or passing dark tarry stools. If you experience any of these symptoms, especially if they are persistent, consult your doctor immediately. How is esophageal cancer diagnosed? The diagnostic process typically starts with a thorough medical history and physical examination. If esophageal cancer is suspected, the doctor may order several tests. An upper endoscopy is a common procedure where a thin, flexible tube with a camera is inserted down the throat to visualize the esophagus. During the endoscopy, a biopsy can be taken to examine tissue samples under a microscope for cancerous cells. Other imaging tests, such as a CT scan, MRI, or PT scan, can help determine the extent of the cancer and whether it has spread to other parts of the body. A barium swallow, where the patient drinks a barium solution that coats the esophagus, can also be used to visualize the esophagus on an X-ray. Esophageal cancer is broadly classified into two main types, squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma arises from the flat, squamous cells that line the esophagus. It is often associated with smoking and heavy alcohol consumption. Adenocarcinoma, on the other hand, develops from glandular cells that have replaced the squamous cells, usually as a result of Barrett's esophagus. This type is more common in the lower part of the esophagus and is strongly linked to chronic acid reflux. The type of cancer determines the treatment approach and can influence the prognosis. Treatment for esophageal cancer depends on several factors, including the stage of the cancer, the patient's overall health, and the type of cancer. Treatment options may include surgery to remove the tumor, chemotherapy to kill cancer cells, radiation therapy to shrink the tumor, or a combination of these approaches. In some cases, targeted therapy or immunotherapy, which use drugs to attack specific cancer cells or boost the body's immune system, may be used. Palliative care, which focuses on relieving symptoms and improving quality of life, is also an important part of treatment, especially for advanced stage cancers. Recent advances include newer chemotherapy regimens, minimally invasive surgical techniques, and improved radiation therapy techniques. Can esophageal cancer be prevented? While not all cases are preventable, there are several steps you can take to reduce your risk. These include quitting smoking, limiting alcohol consumption, maintaining a healthy weight, eating a diet rich in fruits and vegetables, and managing acid reflux. If you have chronic heartburn or Barrett's esophagus, it's crucial to work with your doctor to manage these conditions effectively. Regular screenings may be recommended for individuals at high risk. What is the prognosis for esophageal cancer? The prognosis varies widely depending on the stage of the cancer at diagnosis, the patient's overall health, and the response to treatment. Early detection and treatment are crucial for improving outcomes. The 5-year survival rate for esophageal cancer is relatively low compared to other cancers, highlighting the importance of early diagnosis and prevention. Recent research is focused on developing new and more effective treatments, including targeted therapies and immunotherapies, which hold promise for improving outcomes in the future. These advancements aim to not only extend survival but also improve the quality of life for individuals affected by this challenging disease.